Sandra. Oh, well done. Vera.
Morale is high here, in spite of visits being suspended because of a recent COVID case. And that case was in spite of a high uptake of vaccinations. Of 118 staff, only 3 haven't had one. Abby has been trying to talk them round.
Personally, I think it should be mandatory because we need to protect the vulnerable people that we look after. We need to protect ourselves, our friends, our family, and also reduce the burden on the NHS. So I think it is vital that people have the vaccine.
Yeah, Mary, that's your sticker for your vaccine.
All residents have been vaccinated here. Now the government is consulting on whether all staff in England should be, as a condition of work.
If you're coming into contact with very fragile, frail people who, if exposed to COVID, could likely kill them, then it's only right and it's only responsible for us as a government to consult on this, consider it very carefully, and then, if need be, obviously legislate accordingly.
Some staff who didn't want the vaccine said they were nervous about medical intervention. One believed conspiracy theories.
Whatever people's reasons are for not wanting the jab, the issue here is how far an employer can go in making workers do something that they don't want to do.
The pandemic has already rewritten the way many of us work. Unions say making the vaccine mandatory could be a step too far.
We know that it's a very low-paid sector, deserves to be much higher paid. We know that it's a sector where there are high turnover rates and lots of vacancies for roles. And so the potential risk of people walking away from the sector is great.
Care homes have been badly hit by the virus. For a minimum level of protection, scientists say 80% of carers and 90% of older residents need to be vaccinated. Nearly half of homes in England haven't achieved this. Lisa Dowd, Sky News, Birmingham.